The state of North Dakota recognizes the need for a transportation system that allows for optimum personal mobility. Meeting this goal requires an analysis of existing mobility options, understanding how well those options are meeting the needs of residents in the state, and where there are needs for additional services, and what the funding needs are. This research, which was conducted by the Small Urban and Rural Center on Mobility and funded by the North Dakota Department of Transportation, included a number of objectives, but the primary goal was to assess the public transportation services available in the state of North Dakota. First, we developed a demographic profile of the state, examined population growth and demographic trends, and constructed a mobility needs index, which identified the areas of the state with the greatest needs for mobility services. Second, we described existing levels of transit services across the state, as well as other passenger transportation options. We analyzed data on ridership, vehicle miles and hours of service, the number of vehicles in service, and various performance measures. We also surveyed all of the transit agencies in the state to collect some additional information, such as the geographic coverage of their service and how many days per week and hours per day they provide service. We also collected other information about other transportation options in the state, such as taxi services, Uber and Lyft, Amtrak, intercity bus, such as Jefferson Lines, and veterans transportation services. After describing the existing services in the state, we examined the adequacy of these services for meeting the mobility goals, the mobility needs of North Dakota residents. We surveyed transit agencies, stakeholders, and riders across the state to help us understand how well the needs were being met. The results suggest a need for an expansion of services. The most identified needs were additional days of service, such as weekend service or additional weekday service in rural areas, and also longer hours of service so that they could serve trips earlier or later in the day. Many also identified the needs for additional intercity services, or especially services from small towns and rural areas into the larger cities, especially for healthcare. Transit agencies also commented on the staffing challenges that they face in meeting the demand for services. To quantify the service gaps and the funding needs, we developed some benchmarks for transit service levels and compared existing service levels to those benchmark levels in different regions across the state. The amount of service that we would expect in a region depends on the population and the demographics of that region. We identified regions below the benchmark values as having need for additional services. We calculated how much service would need to increase to meet those benchmark values, and then we calculated the additional cost that would be required to provide that additional service. And that additional cost includes operating expenses as well as the cost of new vehicles that may be needed to provide that additional service. We estimated that annual operating funding statewide would need to increase by 5.3 million to meet the service gaps for both urban and rural areas. By 2030, after we account for projected population growth, we would need an increase in funding of 14.4 million statewide. For rural transit, this would be an increase in funding of 21% initially and 55% by 2030. For urban transit, it's an increase of 14% initially and 46% by 2030. In addition to the additional operating costs, there would be a need for $13.5 million for one-time new vehicle purchases, and that would increase to $33.5 million to meet the needs by 2030. The study also developed a state of good repair model to project retirement years of vehicles and the annual vehicle replacement costs. Another objective of the study was to learn more about who uses transit in the state. About 750 survey responses were received from rural transit riders across the state, and the results provide a description of the rural transit rider demographics. A large percentage of rural transit riders are older adults. Many have a disability, cannot drive, do not have access to a vehicle, or have low income. Urban transit serves a higher percentage of working age adults and students, but it also serves a high percentage of low income riders and people with disabilities. Many riders use transit multiple days per week, and they rely on it as a primary means of transportation. Finally, we examined and measured the societal benefits of transit in North Dakota. And we showed that the benefits of the transit services exceed the cost of providing the service. And that's the case in both urban and rural areas. For more information about this research, you can visit our website or contact me. My name is Jeremy Matson. I'm an assistant professor at North Dakota State University, and I work for the Small Urban and Rural Center on Mobility, or SURCOM, which is a program of the Upper Great Plains Transportation Institute at North Dakota State University. At SURCOM, we provide research and education for improving mobility in rural and small urban communities. Visit our website for more information about this research and other research projects, as well as our education programs and training opportunities.